Hi, in this video I'm going to talk about lifestyle things that you can do to take the best care of yourself during treatment for breast cancer and afterwards. I'll be talking about exercise, diet, and things you should avoid. Let's start with exercise. A lot of people think during treatment for breast cancer that they should take it easy. And this is obviously true. You want to make sure you don't spend your energy doing things that aren't important. On the other hand, becoming inactive and not moving around at all is not going to help you. You'll lose muscle mass, you'll lose strength, you'll lose flexibility. If you're very fit, you'll lose cardiovascular fitness. What we recommend is that you stay as active as you can within the limits of your energy level. I recommend that people exercise outside as much as possible. Natural light is good for your energy level, it's good for your sleep, it can help reduce fatigue during treatment with, for example, chemotherapy and radiation therapy, and obviously after surgery, our energy is depleted. So exercising in natural light at least a little bit every day whenever possible is really important for you to stay feeling as good as you can. A lot of my patients who are runners wonder during chemotherapy, can they still run? Yes, you can. You can run during treatment. You may find that some days you're more tired than others. And it's important to be kind to yourself and to your body. But there's nothing that says you can't do this. In other words, it's not unsafe. In addition to cardiovascular exercise, meaning trying to get your heart rate up or trying to exert yourself so that it's a little hard to sing, you can still talk, is important, and we recommend when people are done with treatment that you try to get 30 minutes of moderate intensity exercise at least 5 days a week. Now the key is it doesn't have to be all at once, so you could do 10 minutes here, 10 minutes there, and 10 minutes another time of day. Park a little further away and walk for 10 minutes, for example, so you can fit this into your daily life. If you've not been active before breast cancer, this is a great time to start. There are other types of exercise. There's strength exercise, resistance exercise with weights. You can start with 1 pound weights and then move to 2 or 3 pound weights. This will help you retain your muscle strength. Doing things like climbing stairs or going up and down on a curb can help keep the muscles in your pelvis and in your thighs much stronger. If you haven't been exercising, this may not be the time to start lifting weights intensively, but try to stay active. You can do push-ups against the wall, for example. Another type of exercise is flexibility exercise. This is important. With time, we lose flexibility in our muscles. Staying flexible with things like yoga can help if you're on hormonal treatment and are having muscle aches and pains. It's one of the most effective things I've seen in my patients. You can do stretching exercises first thing in the morning, throughout the day, or at bedtime, or scatter it depending on your schedule. The last type of exercise is balance. Again, this doesn't relate just to people who've had breast cancer, but in general, with time, we start to lose our balance. Doing things that can improve your balance, like sitting on one of those inflatable balls, or walking on a line or a balance beam in the park, can be really helpful in maintaining your balance. I want to talk next about nutrition and what you should eat during and after breast cancer. In general, we recommend a healthy diet for people on treatment for breast cancer, like chemotherapy and radiation therapy, as well as afterwards. And actually, this applies to your friends and family members who don't have breast cancer. What we want to do is have a balanced diet, and we do try to recommend a colorful diet. The micronutrients are in food that has color, like fruits and vegetables, especially cruciferous vegetables. This would be kale, cabbage, and things like broccoli. Those are really healthy fruits and vegetables, regardless of whether or not you've had breast cancer. Now I'm going to talk for a moment about what to eat when you're receiving treatment, in particular chemotherapy, for breast cancer treatment. you will find that your taste buds are interested in food that you may not have liked before, and that your favorite foods may actually not taste good. In fact, even plain water can taste funny. Some of my patients have said it tastes a little metallic. The way to help with that is to add citrus to your water. You can squeeze a bit of lemon or orange or lime into your water, and that can help with the metallic taste. You do want to try to avoid a lot of juices because they have a lot of calories in them. People commonly think that they're going to lose weight during treatment for breast cancer. And what I have found is that people actually gain weight, in part because they're less active. That relates to the exercise recommendations I just talked about, and partly because they do a lot more comfort eating. People will bring you food, and if it looks good to you that day, you'll eat more because you haven't eaten as much in the previous days. I recommend that unless you have a history of an eating disorder, you watch your weight quite closely. Because if you finish treatment and you've gained 10 pounds, that's one more thing that you're going to worry about. Again, don't be obsessive, just be prudent. So watch what you eat. You might want to follow your weight. Ask to see a registered dietitian to help you maintain a healthy weight during treatment. As I mentioned, some of your favorite foods won't taste as good. I have found that people enjoy eggs, fish. If you're not vegetarian, with a little lemon can be very helpful if foods don't taste that good. If you eat red meat, you may find that red meat doesn't taste as good. And similarly, if you tend not to eat red meat, you may also find it actually does taste good. You're going to have to play around with what's palatable for you and what's tasty for you during treatment. In terms of things to avoid or things to take like supplements or vitamins, it's actually been shown that taking supplements when you're on chemotherapy can make chemotherapy less effective. So if you're on a whole host of supplements, you spend your money on things like vitamin D and other micronutrients that you take from the drugstore or a health food store, talk with your doctor about this. I recommend for my patients that they not take antioxidants during chemotherapy. Why is that? Well, chemotherapy works by oxidation. If you undo that with antioxidants, you're going to decrease the effectiveness of chemotherapy. And again, this has been seen in clinical trials. One exception would be vitamin D. Most people in the United States and many other places around the world are actually deficient in vitamin D. Vitamin D is hard to get in food. We get vitamin D from fish and from other food sources as well. We also make vitamin D through our skin. But with time, we're less efficient in making vitamin D through the skin. So, for example, a 20-year-old person will make a lot of vitamin D through the skin. As we hit our 40s and 50s, the skin production of vitamin D is greatly reduced. And if you wear sunscreen, which you should do, that decreases absorption of the sun rays, decreasing vitamin D production in your own body. So we do say that taking a vitamin D supplement is probably advisable if you live in a northern hemisphere or if you don't have a lot of sun exposure. It's also important to know that there is no evidence that vitamins or supplements can prevent or cure breast cancer. Certainly some diets may be associated with a lower risk of breast cancer, but this does not mean that we can treat breast cancer by just changing our diet or taking supplements. If you're interested in learning more about supplements, talk with your doctor, with your medical team. They can give you information on where to find high-quality information about supplements or vitamins or other things you might be interested in. You'd be surprised at how many patients are taking these medications. Doctors are used to this. Don't be afraid to talk with your doctor about your supplements, vitamins that you've been on before, and whether or not they're advisable during treatment. The last thing I want to talk about is soy. Like most supplements, we don't recommend that you take tablets or shakes or powders that contain soy. We have soy in our diet, though, all the time. It's hard to avoid. It's in almost every processed food. And if you're a vegetarian, you know that soy is a big part of your diet. Taking dietary soy meaning normal amounts of soy that we eat in our meals, is not a risk for people with breast cancer. There's no evidence that plant estrogens or phytoestrogens in our diet are dangerous. That's in contrast to trying to increase the levels of phytoestrogens in your body if you have breast cancer. I've covered a lot today. I hope it's been helpful to you. If you like this video, click like and subscribe so other people can find it.